In this lecture, we will review the cognitive development in early childhood. We're talking about preschoolers between the ages of 3 and 6 years old. Jean Piaget's theory of cognitive development suggests that children move through 4 different stages of learning. His theory focuses not only on understanding how children acquire knowledge, but also on understanding the nature of intelligence. Now, Piaget's stages are, you've got the sensorimotor stage from birth to about 2 years old, the preoperational stage from 2 to about 7, concrete operational stage from 7 to about 11, and then the formal operational stage from about 12 years old and up. Now, Piaget believed that children take on active roles in the learning process, acting much like little scientists as they perform experiments, make observations, and learn about the world. As kids interact with the world around them, they continually add new knowledge, build upon existing knowledge, and adapt previously held ideas to accommodate new information. Now, in the pre-operational stage, we have the foundations of language development, which may have been laid during the previous stage, but the emergence of language is one of the major hallmarks of the pre-operational stage. Now, between the ages of roughly 2 through 7, some researchers say 2 to 6, but Piaget said 2 to 7. Now, at this stage, kids learn through pretend play, but still struggle with logic and take in the point of view of other people. They also struggle with understanding the idea of consistency. Now let's review some cognitive skills to expect from children between 3 to about 5-6 years old. This is from the APA.org. Children's skills include they can think about objects, people, and events without seeing them. Although less than before, still think they are the center of the world and have trouble seeing things from someone else's perspective. They are more able to use words to express thoughts and feelings and to share experiences. They talk about themselves out loud as a way to control their behaviors. They can think of events in the past or those yet to happen. They begin to think ahead and plan their actions, often and anticipate physical consequences of actions that are not too complicated. They started to see the difference between things they see and what they really are. Like, for example, a stuffed dog is not a real dog. They start to see the relationship of cause and effect. Like, if I do this, then that will happen. They ask a lot of why, how, when questions. They learn by imitation, observation, and by exploring, creating, and doing things. They understand that breakfast is before lunch and lunch is before dinner. They begin to understand before, after, up, down, over, under, today, yesterday, and tomorrow. They can't play or do something for long or become bored and tired unless there's an adult guidance. Okay, now in regards to language development, let's go through the years. At age 3, usually, pronouns and prepositions appropriately are used. They use 3-word sentences, and also plural words are used. Now, at around 4 years old, they begin to understand size relationships. They follow a 3-step command, and also they can count up to 4 and name 4 colors. They also enjoy rhymes and wordplay. At around age 5, they show early understanding of time concepts. Also can count to about 10. and knows a telephone number. But to be honest, I don't know anyone these days that could remember a phone number. Everything is just stored in the cell phone. Anyway, they could also respond to why questions. Why this? Why that? Now, stuttering may occur in the normal language development of toddlers ages 3 to 4. It occurs because ideas come to mind faster than the child is able to express them, especially if the child is stressed or excited. Then, when the child is speaking, give your full, prompt attention. Do not comment on the stuttering. Consider having the child evaluated by a speech pathologist if, and only if, there are other signs with the stuttering, such as tics or grimacing or extreme self-consciousness in regards to the stuttering, or if the stuttering lasts longer than 6 months. Okay, so let's go over some behavioral issues. The preschooler learns the social skills needed to play and work with other children. But as time passes, the child is better able to cooperate with a larger number of peers. So, although 4 to 5-year-olds may be able to start playing games that have rules, the rules are likely to change, often at the whim of a dominant child. It is common in a small group of preschoolers to see a dominant child emerge who tends to boss others around without much resistance from them. It is also normal for preschoolers to test their physical, behavioral, and emotional limits. Having a safe, structured environment in which to explore and face new challenges is important. However, preschoolers need well-defined limits. The child should display initiative, curiosity, and desire to explore, and enjoyment without feeling guilty or inhibited. Now, early morality develops as children want to please their parents and others of importance. And I have a whole video lecture on moral development in children that you could look at if you're interested in that topic. Now, this is commonly known as the good boy or good girl stage. So please note, elaborate storytelling may progress into lying. If this is not addressed during the preschool years, this behavior may continue into adult years when we do not want that. Mouthing off or back talk is most often a way for preschoolers to get attention and a reaction from an adult. Just a reminder, according to Piaget, and we have to keep saying that because there are different theorists that have different theories in regards to early child development and cognition. Remember, as kids interact with the world around them, they continually add new knowledge. They build upon existing knowledge and adapt previously held ideas to accommodate new information.